Hi, I'm Chris Clements, and I'm joined by Aarong Lents, Abigail Magruder, Kara Martin, and Olivia Wildeman. And our presentation will be about how occupational therapists can aid individuals suffering from addiction in returning to work. So what is occupational therapy? Occupational therapy practitioners assist individuals, groups, or populations in doing what they need or want to do while overcoming their personal barriers. Occupational practitioners include occupational therapists and occupational therapy assistants, and specific occupations include activities of daily living, instrumental activities of daily living, rest, work, play, leisure, and social participation. So how can occupational therapy practitioners help individuals with addiction return to work? Occupational therapy practitioners can create unique solutions on a per client basis that aids each individual in their return to work, helps them find fulfilling work and the many benefits like income, security, and greater sense of well-being. In returning to work, has a lot of challenges for those suffering from SUDS, like difficulty following a routine, lack of concentration, and pathways back towards addiction. Occupational therapy intervention is able to improve the odds of these individuals successfully returning to work and improve their ability to face other challenges in the future.
So when it comes to identifying the need, we are looking at this through a lens of work. So individuals with addictions have health disparities relating to activities of daily living, instrumental activities of daily living, sleep, work, and social participation. Individuals with addiction often cycle through periods of recovery and setbacks, which results in them being unable to retain a job. So individuals with addiction who have difficulties retaining jobs often face financial barriers that create a need for housing, bathing, and food. So occupational therapies practitioners can help provide services to individuals with addiction seeking to participate in work, including pursuing employment, such as applying for jobs, practicing interview and social participation skills, returning to work, job performance skills, education on job benefits, job negotiation, and financial management, as well as career exploration that takes into consideration their values, interests, beliefs, and roles as an individual.
Resources to support the area of need. In 2017, the state of Indiana saw its highest overall drug overdose rate at 2.94 per 100,000 people, which was a 22% increase from the year prior. Indiana also consistently fell in the top half of the U.S. overdose death rate since 2013. A report from Evansville Courier and Press stated that a report compiled by Vanderburgh County Health Department showed 66 people overdosed in 2020, which went up from 54 in 2019. Fentanyl claimed 27 of those lives, and 63% were men, and 83% of victims were white. The misuse and addiction to opioids have become common chronic illnesses in the U.S. Although there are effective treatments for opioid use disorder, only about 1 in 4 people with this disorder receive any type of specialty treatment. Recently, more than 27 million people in the U.S. reported that they are using illicit drugs or misusing prescription drugs, and nearly a quarter of adults and adolescents reported binge drinking in the past month. The annual economic impact of substance misuse is estimated to be $249 billion for alcohol misuse and $193 billion for illicit drug use. Local impact. Social determinants of health affect overall health outcomes and are at risk factors for substance use disorder. Employment opportunities are directly related to available finances and health coverage, which impact substance use disorders and options for treatment. Occupational therapy practitioners are uniquely qualified to provide assessment and interventions for these clients to support participation in community engagement, including obtaining, maintaining, or returning to employment. Currently in Evansville, Indiana, there are no occupational therapy practitioners that work specifically with these individuals in any rehab or treatment center. We did an interview with Brentwood Springs, and they were unsure how to incorporate occupational therapy practitioners due to the level of understanding the role in mental health and the addiction sector. They had concerns for the regulations, but they have not been introduced to occupational therapy practitioners in their clinical hierarchy. The skills of an occupational therapy practitioner could prove benefits, but regulations may hold practitioners back in this setting.
So for who our needs assessment will inform, state and local politicians could shine a brighter light on addiction as a whole and help advocate for improved addiction recovery. Local centers for addiction that focus on aftercare and creating new opportunities for people struggling with addiction, as well as occupational therapy practitioners who work in mental or social health, who can provide a unique service towards people with addiction.
Some community resources that are local include Brentwood Springs, which is in Newburgh, Indiana. They have an inpatient and outpatient treatment program. There's Deaconess Cross Point in Evansville, Indiana, which is an adult intensive and outpatient program. Southwestern Behavioral Health Stepping Stone in Evansville, Indiana is a residential program that includes free recovery support groups, family programs, and outpatient programs. The residential program states that they have services to help with employment. Boyette Treatment Center in Evansville, Indiana is an individual in-person appointment or telehealth appointments, and they also have group therapy. On their website, it states that they do have career counseling. There is the Comprehensive Treatment Center in Evansville, Indiana, which is an outpatient opioid addiction treatment for individuals who are 18 or older. There is Clean Slate in Evansville, Indiana, which is an outpatient addiction treatment center. They have drug rehab, addiction, and alcohol treatments. Counseling for Change is in Evansville, Indiana, which is an outpatient treatment program as well. And then there is Now Counseling in Evansville, Indiana, which is a residential service with partial hospitalization services, outpatient services, transitional services to a sober living program that includes 70 beds in 9 houses. But there are no occupational therapy services at any of these local community centers or services in Evansville or Newburgh.
When addressing the question, how does the area of occupation prevent disease or prevent dysfunction? Through a person standpoint, Modini et al. Stated that work can be beneficial for an employee's well-being, particularly if good quality supervision is present and there are favorable workplace conditions. Individuals with mental health illnesses identify various meanings and benefits from employment, including greater autonomy, status and acceptance within society, opportunities for personal development, and a sense of well-being.
So building off of what Olivia said, how does the area of occupation prevent disease or prevent dysfunction in regards to a group lens? Affirmative social support and social supervision and interpersonal interactions within a work environment is one example of how group and populations with addictive related disorders can prevent dysfunction, including reducing anxiety and depression symptoms. Current research suggests that employment meets psychosocial needs and is able to facilitate recovery from a mental illness.
Looking at a population standpoint, the benefits of employment on mental health include organizational citizenship behavior, feeling welcomed, respected, and supported through positive social interactions at work. It meets psychosocial needs in societies where employment is considered a social norm, which is our society, and this leads to status and acceptance, facilitates recovery from mental illness, and affirms social supports. Other benefits and implications include that unemployment has effects on health and health deteriorating behavior. Unemployment is associated with a greater risk of morbidity, including mental illness. Intervention programs for unemployed people are moderately effective, and employment is the #1 mean for achieving adequate economic resources. So we conducted a stakeholder interview with Brentwood Springs, and issues important to this community outlined in the interview were daily function and relational skills, stabilization during acute crisis or substance detoxification, and barriers include stress management, emotional regulation, communication, time management, professional skills, insurance coverage, homelessness, stigma, limited resources, and high caseloads.
During our interview with Brentwood Springs, we discussed the feasibility of addressing this community need. And we found there was difficulty finding space in Brentwood Springs due to funding and the nature of their clients. We discussed the possibility of creating a just reason for OT services, but limited to a few hours a week. And their clients there are specifically for post-crisis stabilization, where return to work and work social skills are not their main priority.
Some possible impact or consequences of addressing the need include improved quality of life for those suffering from addiction, as work provides purpose and creates a stabilizing environment. Also, that it reduces potential for setbacks in addiction-related disorders. And finally, it creates more job opportunities for occupational therapy practitioners in community mental health settings. A few other important content that we got from the interview were that barriers affecting those with addiction and their success in working include stress management, emotional regulation, communication, verbalizing needs and wants in a professional way, time management, and professional skills. Brentwood Springs also uses the Basis 32 for their assessment. And then insurance does not cover meth addiction for inpatient rehab. And finally, even if clients cannot afford Brentwood, individuals addicted to a drug that would be dangerous to detox from can still be admitted.
So our solution that we came up with was to include occupational therapy services for Brentwood Springs Intensive Outpatient Program. And this is for individuals with mental health or substance use needs without 24-hour medical care of intensity of a partial hospital program. It's 3 to 5 days a week with a 3-hour treatment schedule, and it includes group therapy, supervised medication management, education, training, skill building, and support meetings. So the occupational therapy practitioner could administer the Canadian Occupational Performance Measure at the start of the program that helps share goals with the treatment team. We could administer the worker role interview to gather information about psychosocial and environmental factors affecting clients' ability to work. Interventions may include cognitive behavioral therapy techniques, emotional regulation, resilience-based approach, wellness, education, advocacy, and implementing other work-specific skills.
In regards to the consultation process regarding occupational therapy and individuals returning to work who have addiction, we can take the person, group, and population perspective. So for person, the individual can completely obtain, sustain, and perform their job as expected to the standards. For group, we can have people recovering from addiction work well with others by communicating, providing qualities expected, such as teamwork and leadership, and then also work well together in workshops by providing group therapy interventions related to building social communication and participation skills. For the population perspective, we can provide skilled workers to the economy, help people with addictions find purpose and sustainable lives, and provide statistically significant research for people returning to work while recovering from addiction, with the concept of occupational therapy being able to help them. So in regards to the domain and process, using the evaluation, we can assess the need for services with a client-based approach, assess their current skill levels, obtainable skills, their goals, emotional and mental status, as well as their strengths and weaknesses. For intervention, we can include group therapy, work hardening skills, ergonomics, emotional regulation, social communication, and participation skills, as well as instrumental activities of daily living. And then finally, for the outcome, we could have a plan of care and discharge planning for their status of employment, consultation with other healthcare professionals, provide referrals for professional opinion on further treatment, as well as advocacy for the patient and provide resources.
Where other medical professionals could aid in this process, social workers could provide resources in the community to help navigate the healthcare system. Vocational therapists can help those with disabilities achieve employment. A prosthetist can help those with disabilities use adaptive equipment to improve function as needed. And mental health professionals can further consult outpatient mental health for mental health issues.